Hey everyone, this is Samir Islam, and I'm going to give you some social media tips that you can help to implement in your practice for the TSGE. So I have my own YouTube page, I have a Facebook page and a pretty active Instagram page as well, and I've been doing videos on social media for quite some time. And the reason I did this is because I thought that this would give me an avenue to help explain a lot of the conditions and diseases that we deal with on a basis that is not in a rush clinic. I can speak to my personality, I can make jokes, and also patients seem to enjoy these videos because it provides them education that I can't usually do in a typical clinic setting. The other impetus for doing this is that this is where our patients are. They're on social media, they're looking at videos, they're on Instagram, they're on YouTube, they're researching and looking up things. And I think it's important for us to actually give them accurate information that they can know so that you don't have to have them ask you kind of questions that are really not related to medical science. It gives them knowledge and it gives you a way to show who you are outside the medical setting. So how do we do this? Here are 5 tips I recommend you can do today to start with social media. Number 1, use whatever equipment that you have. So now I have a camera, I have a microphone, I have lighting, but when I first did this, I just used my iPhone. That was it, and that's all you really need. The iPhones that you have or the smartphones that you have are great, they're effective, they have great video quality, and just start with that. It's really simple. Just use your iPhone, use your phone, click on the video camera and just record. Tip number 2, record on topics that you know. So easy, we all know about colon polyps, we know about hemorrhoids, we know about IBS, bloating, diarrhea, H. pylori, cirrhosis, hepatitis C. The list goes on and on and on. Don't make it complicated. Do a little thing on hepatitis C. What causes it? That's one video. How do you treat it? That's one video. How do you get it? That's another video. It's really simple. Break it down into really simple things. I usually do symptoms, diagnosis, treatment, and maybe follow-up. And those are 4 videos on one particular topic. Number 3, talk about your experiences as being a doctor. People love to see what it's like to being a doctor. You see shows like ER or other medical shows like Grey's Anatomy. These are big hits for everyone, and people want to know what it's like to be a doctor. Talk about your experience. Talk about some of the things that you go through, the struggles, the problems with maybe being on call, maybe having to deal with patients that have a disease like colon cancer. Talk about that because people want to know exactly who you are and they want to know you as a person. Tip number 4, don't worry about making mistakes. It is fine. Guys, we're humans. It's not a big deal. No one's going to expect a Oscar-winning video whenever you do a video for this. People just want the information. The information is vastly more important than all the setup, more important than looking polished or looking great. It's okay to make mistakes. It's okay to fumble. Not a big deal. Tip number 5, just get started. Start just as soon as you can. Use whatever you're using. Use an iPhone, use an Android, and just start recording. Who cares if it's sloppy? Who cares if you make mistakes? The first step is to just get started, and over time, you'll start to get your groove. You'll start to know exactly how you want to speak. You'll have a personality on screen. It'll become easier and easier and easier. But these are 5 tips I recommend for anyone who wants to start social media. For me personally, it's been a fantastic experience. I've had more exposure, patients come to see me, I've gotten different speaking gigs. It's been a great way to show my presence. Hope you guys enjoyed this video. I want to thank TSGE for allowing me to speak on these tips for social media.